Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. Welcome to The Cancering Show. I'm your host, Dr. Jennifer Young-Pierce. Today, we have an important episode in store that delves into the latest advances in cervical cancer screening, specifically the growing trend of HPV self-collection and what that means for you and your loved ones. I'm excited to welcome Dr. Rebecca Perkins, a leading expert in cervical cancer prevention and one of the authors behind the guidelines your doctor follows for abnormal Pap tests. In addition, she's a longtime friend of mine from our days in residency together in Boston. Together, we're going to explore the pros and cons of the current HPV testing guidelines, dive into the differences between Pap tests and HPV tests, and discuss who benefits most from these new self-collection kits. If you have any questions about how these options work, whether they might be right for you, or what are the next steps after a positive test, this episode has all the answers you need. Dr. Perkins, welcome to the show.
It is my pleasure to be here and to talk to you again.
Rebecca, it's so fun to see you always and to have you on the podcast. You know, we go way back, and I think even when we were residents together, I don't know that we envisioned a time where we would have cervical cancer testing so close to being at-home kit. We want to break down for our listeners the pros and cons of current testing that's available and the subtleties and the differences of who can get it, how they can get it, and who should take advantage of these new HPV self-collection kits. So before we dive in, tell us a little bit about yourself and how you became so focused in this area of GYN.
So I became focused in cervical cancer back when we were residents together, which I won't say how long ago that was, but it's been a while. And I've been in the cervical cancer prevention space ever since, doing work most recently with different screening options. And I co-chair the Enduring Guidelines process, which is 19 different national organizations that make guidelines for new technologies and management of abnormal screening tests.
Yes. So for those of you listening, when your doctor says this is what we need to do about your abnormal Pap test, Dr. Perkins is the author of those guidelines. That's how important she is in the world. And we are so, so grateful to have her here with us. So tell us just the smidgen, one-liner about that connection between HPV and cervical cancer and why HPV testing can prevent cervical cancer.
Well, that's an easy one because HPV causes 99.7% of cervical cancers. So it's really difficult to get a cervical cancer if you don't first have HPV. So HPV testing is an advance in screening because each time you do an HPV test, it's going to pick up 90% of precancers and cancers. Versus a Pap test, which is a great test, picks up about 70%. So you're missing more things with your Pap test than you are with your HPV test, which is why you can do the HPV testing less often.
And I love an analogy somebody made that the HPV test is the iPhone, the Pap test is the rotary dial phone. We know it's not quite that simple because Pap testing has had improvements over the years in terms of its specificity, but it's never gotten above that 70%. So I think that's so important.
I like to say that the HPV test is like a crystal ball because it not only tells you if there's something going on today, but it also tells you what's going to happen in the future. And the Pap test is like a photograph. It tells you what's happening today, but it doesn't tell you anything about what's happening next year.
Oh, I love that. That's fantastic. I'll use that in the future.
Thanks.
So tell us how we currently test for HPV most of the time.
So most of the time we test for HPV with something called co-testing, which is where the patient comes in, they think they're having a Pap smear, and actually what's happening is they're getting a Pap smear and the HPV test at the same time. Both the tests are sent to the lab, and then both results come back at the same time.
I do tell my patients when they're getting their Pap testing done to make sure to ask for the HPV test. I think too often they're getting a Pap test but not being offered that HPV test, and we really want to make sure What I always say is it's so important to know your HPV status, that
Hmm.
every patient knows what their most recent test was, because that determines how frequently you need to come back.
Yep, absolutely true.
And so just review that for us, kind of the people who are HPV positive versus HPV negative.
So if you have 1,000 people who are going in for screening, or 100, I'll make the math easier, 100 people who are going for screening, any given time you test, somewhere between 10 and 25 of those 100 people, so 10 to 25% of your population is going to test HPV positive. That does not mean that all of those people are going to go on to get cancer by any stretch of the imagination. So, but some of them will. So if someone tests HPV positive, it's really, really important for them to get another test. So that might be a pap test. It could be a test we have now called a dual stain. It could be a colposcopy if they have a very high risk type of HPV. But it's really important to get another test because most people will not have precancer, but a few people will. So an HPV positive test isn't something you should ignore. You need more testing to figure out what to do.
And what I like to tell folks, especially folks who are getting co-testing, and it depends on whether or not people are getting co-testing or whether or not the doctor is simply collecting an HPV swab. But sometimes the pap test, or even what we call the reflex testing to determine which type of HPV, can be done on that positive HPV test without the patient having to return to the office. So I think that's important for patients to understand as well.
That is important. And the other thing that's important about that is that can only happen if it's collected from the cervix. So basically, if someone is having what they think is a pap smear, so an exam with the speculum where the doctor or healthcare provider visualizes the cervix and takes a sample of cells from the cervix, then you can test for HPV and you can do a pap and you can do a dual stain. You can do all the tests because you have the cervical cells. If someone does an HPV self collection, which again is a very good test, it's going to pick up 90% of your abnormalities. If it's positive, you don't have the option of the lab running an additional test. They might be able to tell you what type of HPV you have because that comes with the HPV positive information, but they're not going to be able to run a pap test that can tell you what's going on with the cells. So most of the time, if someone does a self-collection to start off with, if it's positive, they'll have to come back to get the speculum exam and get the pap test with their provider.
Excellent point to differentiate between those two tests. And we're going to really dive into that. I did want to, before we move on to that, just because I correct my residents and medical students on this all the time, we need to remind ourselves that the HPV test is a test for high risk HPV.
Correct.
So there are patients who can have low grade pap smear changes, who can have genital warts caused by HPV, and test negative for HPV, meaning they are testing negative for the high risk cancer causing types, but might have a low risk type.
Exactly.
Yeah.
Yep. We don't want to know about those because they don't cause cancer.
Exactly. Which is why they're not included when the lab runs the group of tests. Exactly. So tell our listeners about HPV self-collection. What is it and who can get it?
So this answer to this question is ever changing. So right now, most people can get self-collection in their doctor's office. So that means they go in to see their doctor or primary care provider or nurse practitioner, and the person says, "Would you like to screen for cervical cancer today?" in the bathroom by yourself without using a speculum. And the patient says, "Whoopee, sounds great to me." They go into the bathroom with a swab, insert the swab, basically like a Q-tip, into the vagina for about 30 seconds, and then put it in the little tube, and that's the end of the patient experience. And then the lab will continue to process that. And then for people who are HPV negative, they're done for the next 3 years. They don't need another test. For people who are HPV positive, as we mentioned, they'll need to come back to get the speculum exam. Right now, for most people, it is going to be an in-clinic option. There is an at-home test, but right now it is only available through private insurance or self-pay and only available in California.
All right. So we're going to leave that home, futuristic home self-collection off to the side for a minute. And let's talk about the in-clinic self-collection. What I love about it is it really opens up to make it easier for patients to have cervical cancer screening in the internist office, in the nurse practitioner's office, in the family medicine office. Not that a lot of people have pelvic exams in those offices too, but they also are not places traditionally where you think about going for a pelvic exam. And so it could really expand access to cervical cancer screening. Of course, we are super excited to be offering it on a mobile unit staffed by nurses and nurse practitioners that has a clinic setting and, can be seen as a clinic visit. So we are super excited about that. But at the same time, we want people to understand there are some people who should still go see an OBGYN or see a family medicine doctor and get a pelvic exam. Can you lay out for us who those people are?
Yes. So the first category of people is if you are having a problem, if you are having irregular bleeding, you need to have an exam because we don't know why you're bleeding, and the HPV test is not giving us the answer. So that is it. That is the first thing. If you have abnormal bleeding, it's also at that point no longer screening. It's a whole diagnostic workup. Please, please, please go see your friendly neighborhood gynecologist.
Right. And as the cancer doctor, pain is the same. Pain and discharge, any sort of gynecologic problem.
Yes. And a lot of times, like discharge is extremely common, and many people will actually do a self swab for discharge as well. And, get a self swab. It was yeast infection. Take the yeast treatment. You feel better. Okay, fine. But if you don't, go see your friendly neighborhood gynecologist and make sure you get an exam. And do not accept more yeast treatment if it didn't work the first time. So that's the first group of people. The second group of people who are on significant immunosuppression, so if someone is HIV positive or someone has a kidney transplant or is on, has lupus and is on a heavy duty immunosuppressive drug, they are recommended to have the pap test and the HPV test together because the rates of being HPV positive are very high because normally the immune system makes the HPV quiescent. But if someone's immune system is suppressed, they're more likely to have HPV sort of hanging around, and you really need that second test to make sure it's not doing any harm.
Excellent.
The third group of people, which is a very small group of people, is people who are exposed to DES or diethylstilbestrol in utero. They're recommended to have regular pap smear because they are at risk for a very rare type of cancer that's not HPV related, but that is a very small number of people at this point.
What about people with a history? That's what I think you're about to address the one I was going to ask. Yeah. What about people with a history of HPV positive or cervical dysplasia that's been treated?
So it is strongly preferred that they get an exam with a cytology, with a pap test and the HPV test. But if the only exam they can possibly get is a self-collection, that is way better than no test at all. But if you can do for them an exam in the clinic and get the HPV test and the pap test, that is better, partly because they're higher risk for having cervical precancer, partly because they're at higher risk for still being HPV positive, which means they'd have to come back. And so it's better to do the one-stop shopping. And partly because we just don't have a lot of data on self-test results in this population. So we think it's as good, but we don't have the long-term data showing that it works really well in this population like we do in the screening populations.
And I think data and testing is exactly where we're going to dive into home testing. Tell us about the trials for home testing and where you think home testing is headed.
So right now, there is one device that has been FDA approved for home testing, which is the Teal wand. This was tested in about 600 patients using the Roche Cobas assay, and it seemed to perform similarly to a clinician-collected specimen in a simulated at-home environment, which means they collected it at on the same day in the clinic and then got the clinician collection on that same day. And then the clinic had it sit there in a closet for 9 days and then mailed it to the lab.
Not quite the same as home.
Not quite the same as home. You can see why they did that because you have to have the two, collections at the same time. But, does that account for someone does their specimen collection in Texas in July, and then it
Right.
sits for 2 days in the mail truck. I don't know. Like, I'm not sure.
Right.
So there is an ongoing trial called the SHIP or Last Mile trial. I forget what SHIP stands for. And that is looking at two different, it's looking at actually three. It's looking at multiple different combinations of collection devices and tests. And it is, people are doing it at home and mailing it in. And it's in multiple sites across the US, and that's expected to result either late this year or early 2026. And that's going to give us more sort of real world comparison. So right now, Teal is available, but it's a telehealth service. And it's only available in California. So you have to
Okay.
become a patient of Teal primary care, which right now they're working with insurances. And there's a self-pay option. I'm not sure which insurances they contract with, but they specifically said they don't contract with Medicaid. And then they'll mail it to your house, and then you can take it and mail it back. But then since it's a telehealth service, they'll tell you your result is abnormal, but then you still have to go find a gynecologist. So I feel
Right.
like this is very cool, but this is not what we're going to be using to close the healthcare gap of our currently underscreened populations.
Got it. Of our women who really aren't able to get to the OBGYN for their regular screening because I don't know about you, but they're doctors or they are busy moms or they are, in some other way unable to make it to that appointment. So we hope technology will become much more widespread. And I think we all envision a day when it will be similar to the Cologuard or to some other test where it could be mailed to you or given to you at the doctor's office and then dropped off again, etc. So I think that we're excited about what those options would be.
But I think a difference between that and Cologuard is the 75% of people who are overdue for screening did make it into the doctor's office in the past year.
Interesting.
So people are coming in, they're just not getting screened when they do come
Are
in.
there, right?
Exactly. And so having the opportunity to say, hey, you're overdue for screening. I know we only have 15 minutes, but when we're done, go to the bathroom and take this test versus,
Right.
hey, you're overdue for screening. We have 14 things on the list and I don't have a chaperone and I don't have time to do your pelvic exam today. Let's do it next time and next time never comes. I think we're going to
Right.
see a huge amount of benefit from the in-clinic collection.
Yeah. And
Just
it's
because it's so easy and you
just
can
as
do it fast.
simple as doing a urinalysis or a pregnancy test. It's, yeah, easy peasy. I love it. Now, tell us what somebody should do when they get a positive test.
They should hopefully be contacted by their healthcare provider, but if they are not,
Exactly.
they should contact
Exactly.
their healthcare provider. And then the tests that are currently approved for primary HPV testing all are going to tell you if you have HPV 16 or 18, which are the highest risk strains of HPV. And if someone is positive for those high risk types, they can go straight to colposcopy. So at the time of colposcopy, which is an exam of the cervix with light and magnification by a specialist or gynecologist, where usually small biopsies are taken to look for precancer, that person would collect a pap test at the same time. So you'll then have those three pieces of data. You'll have your HPV result, you'll have your pap result, and you'll have your biopsy result. So you can be really sure that the patient does or does not have a cervical precancer.
Yep. And then just to fill in that gap, for cervical precancers, of course, we recommend some type of what we call excisional procedure, which is the lumpectomy of the cervix. And if you're really wondering, while we're on the topic, this is my soapbox. How does one prevent HPV? If you haven't already listened to one of those episodes, of course, the HPV vaccine is the thing for the next generation. And we can always talk more about that.
90% reduction in cervical
I
cancer by the age
know.
of 30 if it's gotten as a
I
teenager.
know.
It's
I know.
amazing.
It is amazing. And, we always say 2 by 13 or 3 after 15. We really want to get everybody vaccinated. But, I think I want to go on to say, what do we say to patients who maybe their doctor is not currently offering self-collection? When do you expect this to be the norm?
So if the HPV test on self-collection is positive, but it's not 16 or 18, so it's one of the other types, that's the time that you'll need to contact your primary care provider and make sure you go in and get the pap test, because that's going to tell you then if you need to go on to get the colposcopy, or if your pap test is normal, you'll just need to repeat the testing in 1 year.
Got it. And yeah, I do like to say this to folks that, yes, it does mean we want you to come back, but it is no different than if you had a low, in the old days when people were having kind of low grade abnormal cells and would come back yearly and not be allowed to space it out. Knowing your HPV status, whether it's negative versus one of the 14 types that is not 16 or 18 versus positive, helps you and your doctor to decide how frequently to follow you and how much testing you need to reassure you both that there is not precancer or cancer present.
Yeah. And if you're HPV positive, you should never wait more than a year. There is zero situations in which it's okay to wait more than a year to get another test.
Exactly. And I know you and I have talked about this previously, people who are repeatedly getting that high risk HPV positive, PAP negative, should go on to some type of colposcopy or diagnostic procedure.
Yeah. Basically, two strikes and you're out. If you're HPV positive twice in a row, even if your PAP is normal, you need to go to get a colposcopy because the PAP is not totally perfect.
All right. Rebecca, we're all so excited about this new test and new testing modality. What do patients do when their doctor is not currently offering it? When do you think it'll be the norm?
So it's starting to become available in different places. So I think at Kaiser Permanente in California started offering it a while ago. After the FDA approvals, people are starting to stand it up. I think Quest and LabCorp, the two, giant corporate labs, are starting to offer it. But you can't just have them send you some kits and then you're all set. Because the lab needs to know, was it a cervical sample and they can run the pap test? Or was it a vaginal sample, a self-collection, and the patient needs to come back? So you need to set up a order in the electronic medical record that says like self-collect vaginal, and then you do that order and the patient goes to the bathroom and then the lab processes it correctly. And then you need a new workflow because all of a sudden you're going to have all these patients who are HPV positive and need to come back for a pap. Whereas before, the lab just gave you the pap back because they were getting a co-test or they were getting a cervical sample where the lab ran the HPV and then ran the pap if it was positive. So you all of a sudden have twice as many patients who need to be called up for follow-up because among your 10 or 20 out of your 100 patients who test HPV positive, half of them are going to have normal paps. So in a system where all the results came back to you, those people, you're like, okay, see you next year. I'll send you a letter. But now they're coming back to you as HPV positive and they all need to be called in for appointments. So it's really important. And you'd also need to screen for eligibility. So before you implement self-collection, you need to set it up so that it expands the number of patients you're screening and doesn't wind up causing problems like, oh, I screened someone, but then they were lost to follow up because I didn't have a system in place, or I, screened someone with a kidney transplant. Oops, so it needs to be done thoughtfully. And that takes a while because updating the electronic medical record is never a quick process. So absolutely. I know a lot of places that are putting it in place, but it takes a few months to get it rolling.
Got it. And a few months might be a few years for places that, we are in Lower Alabama. We understand how that works a little bit, not quite as rapid introduction as Boston. But, I think that the technology is there and the desire to get this in patients' hands is there. And the more patients say, hey, I would really love my doctor's office to offer this test, the more motivated doctors are to get the work done to offer it. So we would encourage you to reach out to your doctor, ask if they offer it. Make sure you're up to date on your screening. And then the next time, which hopefully will be 3 years from now, because you'll be negative, they'll be ready for you. So that's super exciting. Where can our listeners find out more information about this?
So the American Cancer Society recently released frequently asked questions about self-collection, and I think that is a great resource.
Excellent. If you'll send that to us, we'll get it posted on our page.
Excellent.
Anything else we should be talking about that we haven't had a chance to cover?
Just one other place that has lots of information, although it has information on self-collection, but it's more general, is a website that I built called cervicalrisk.com. And it has a personalized risk tool, so you can plug in all your prior abnormal results and it will tell you what the guidelines say. And it also has information on vaccination and screening.
Fantastic. I did not know you had done that. That's amazing. Awesome. Dr. Perkins, thank you so much for being on the Cancering Show today. We are so excited to have you here and so appreciate your expertise. I can't wait to offer that website to my patients and to use it for friends and family because they always call.
Awesome. It was great to be here with you. It was really fun.
That's a wrap on this episode of the Cancering Show. A big thank you to Dr. Perkins for joining us today and for sharing her expertise on HPV testing and cervical cancer screening. Here are a few things that I took away from our conversation. First, HPV testing is a powerful tool in preventing cervical cancer. It can detect more precancers and cancers compared to the Pap test. If you have a cervix, you should know your HPV status. Second, self-collection with HPV testing makes screenings more accessible, especially for right now in the clinic. This is helping people who already see a doctor but maybe don't want or don't need a pelvic exam to get screened. Keep in mind, home testing kits are on the frontier, but maybe not yet ready for prime time. Finally, if you do test positive for HPV, it's essential to follow up with your healthcare provider for additional testing or potentially treatment to prevent cancer. Thank you so much, Dr. Perkins, for your valuable insights and for creating resources like cervicalrisk.com to empower both patients and our providers. And thank you to all of our listeners out there for tuning in and taking charge of your health. Don't forget to check out the American Cancer Society's frequently asked questions about self-collection to stay informed on the latest in cancer prevention. Until next time, keep cancering and take care of yourselves.
Thanks again for listening. And don't forget to submit your questions at www.cancering.com. We're here for all of those questions and we'll get you the answers. This show is brought to you by the University of South Alabama Mitchell Cancer Institute. MCI is a cutting-edge cancer research and patient center built to fight cancer smarter in Mobile and Baldwin County, Alabama. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment population of more than 4.1 million people, with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond, with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or search for us on Facebook, Twitter, and Instagram. Mitchell Cancer Institute is a member of USA Health. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.